has many benefits, and the accuracy that I'm able to gain during the surgery, the information that I'm able to retrieve and then use to change the procedure that I do to help me do it somewhat better has been very helpful in my practice to reduce some of the complications and give patients a better result. In hip replacements, navigation is very helpful to cut down on two of the most common issues that patients have with the replacement, and that is the possibility of dislocation and leg length, which is a discrepancy between the length of the operative leg and the non-operative leg. Navigation allows me to more accurately assess the patient's leg length and what it would be after surgery before we even perform the cuts, and it helps me place the cup position in an orientation that helps create more stability in the hip and reduce the chance of dislocation.
We adjusted the workflows of our navigation software. For example, we have a so-called express leg situation workflow, which just measures leg length and offset, which are the most important parameters for the surgeon.
Getting the offset correct, getting the leg length correct. I think that's absolutely critical in hip replacement. So we now have the express leg length workflow, which I think is fantastic. And the beauty of that is that you don't have to place pins in the distal femur, yet you get a very accurate reading for leg length and offset. During the procedure and when I've closed the patient, the things are exactly where they should be. But I think in the long term we can show that these components, when put in accurately, will last longer, and we can also show that the risk of dislocation is lower.
Makoplasty Hip, providing a new level of accuracy and precision in total hip arthroplasty with the assistance of innovative robotic arm technology. Makoplasty Hip is a revolutionary surgical treatment option for adults needing total hip arthroplasty. RIO Robotic Arm Interactive Orthopedic System assists surgeons in achieving a new level of precision and more ideal hip implant positioning. Surgeons preoperatively plan each patient's Makoplasty total hip procedure. The CT scan and RIO provide a three-dimensional view of the joint and diseased anatomy, enabling an optimized procedure plan. Cup inclination, cup version, combined anteversion, and postoperative leg length are critical elements of total hip arthroplasty and are accurately planned for the individual patient preoperatively. During surgery, the patient's unique hip joint is registered and aligned to the preoperative plan. The surgeon plans and accurately defines the level of the femoral neck resection in order to achieve ideal leg length restoration. Once the head of the femur has been removed, the femoral canal is prepared using broaching instruments. The broach tracker is applied on the taper of the trial femoral stem, and femoral version is measured. Utilizing the femoral version, the orientation of the acetabular cup can be intraoperatively adjusted to provide the optimal biomechanical reconstruction that is specific for each patient. During Makoplasty, the RIO provides tactile feedback, 3D visualization, and auditory guidance as the surgeon prepares the acetabulum for the implant. The surgeon is assisted in providing accurate and controlled preparation of the acetabular bone to ensure the cup is placed according to the patient's unique surgical plan. The RIO-assisted cup impaction step of the Makoplasty procedure begins by easily switching from the acetabular reaming tool to the cup impactor. As the surgeon prepares to impact the implant into its final position, the RIO holds the acetabular cup at the desired inclination and version defined in the surgical plan. RIO also assists the surgeon in determining when the cup is fully seated. Surgeons can then evaluate the position of the implants and the postoperative leg length before leaving the operating room with a new level of confidence using robotic arm technology. Makoplasty Hip, providing a new level of accuracy and precision to total hip arthroplasty.